Hi, podcast family. I'm Shaletta Brundage, founder and CEO of ShalettaMakesMeLaugh.com, the only podcast network here in Minnesota that celebrates Black culture. And when I found out Dr. Krish was hosting a podcast, I said, let me introduce you to our podcast community and family here in the Twin Cities. So I am here on his first episode of Demystifying Medicaid with Dr. Krish. He is on his own show joining me today. Thank you for having me and letting me introduce you to our Minnesota podcast family.
Shaletta, thank you so much for opening up your family to us. It is a gift to share family, and we're so grateful because we think this is a really important topic. We think healthcare is really important. We think making sure people are covered is important, and so the fact that you would share your friends, your family with us is such a gift, and we're grateful.
You know, I make sure that when I get information and access, I pass that along to other people. And when you told me you were doing a show about demystifying Medicaid, I knew that people in the podcasting community in Minnesota needed to hear this. Now, you are an expert, but a lot of people are wondering, who is Dr. Krish and why does he have a podcast? And you have to tell us all about who Dr. Krish is.
Well, it's a fair question. So my name is Krishnan Nambudiri Subramanian. It's a long name, but a proud name. And but everyone calls me Dr. Krish or Krish. My mom calls me Krish. Patients call me Dr. Krish. So that's what people should call me, is Krish. I am a pediatrician. And my role is awesome, Shaletta. I get the greatest job. I get to walk with families and young people through really some of the most joyful moments in the world. You know, that moment that baby comes out, the moment that you see on the growth chart that you've grown up to be 5'5" or whatever it is. That's a beautiful moment where we celebrate health. And then I also have the responsibility of walking with people through some of the most challenging moments, and we take that honor and privilege real seriously. So I'm a pediatrician, and I hold that very, very proudly. But Shaletta, I'm a family member, and that's the identity I probably hold closest to me. I'm the father of 3 little ones, so I'm growing and learning every day in this world of pediatrics. I'm learning from patients, learning from families, learning from community. On how to be a better father and a better family member. I am a husband, I'm a brother, and then I'm the very proud son of 2 folks who immigrated to this country from India.
Now tell me more about your parents.
Yeah, so they came to the United States in 1972, and they ended up in Michigan. In East Lansing, Michigan, where they became Michigan State Spartan fans. They became Magic Johnson fans, and that followed them. And somehow they ended up in Minnesota, Shaletta. And had they known the weather and the cold, I don't know if they would have ended up here, but they made it here. And so I grew up here in Minnesota. I grew up here cheering on the Vikings, maybe not speaking my mother tongue so well, but being able to quote Simpsons lines left and right. And rather than eating the Indian food, I would opt for the macaroni and cheese. So grew up a little bit confused, but grew up here in Minnesota, surrounded by loving family.
Now, I want you to talk to me about why healthcare is so important to you, because you jumped into this field and you wanted to make a difference. Why is that so important? How did this all get started?
Yeah, well, I'll tell you a story about my family, and then we can talk about how I got into medicine specifically. Shaletta, my father passed away a few years ago now, and we're really lucky. They had a physician in the family. They had access to providers, and it was still the hardest year of our life, the hardest moments of our life. And it was really complicated. And how do you make this decision or that? How do you make sure the bills are paid? It's not easy for anyone. And I know for many of our neighbors, it's incredibly challenging and complex, and adds a whole lot of stress on what's already a stressful situation. And so that's our family's story. I didn't think I was going to go into medicine.
So what was your original plan?
Yeah, I don't know. I don't know, Shaletta. But I went to college and I said, I'm not going to be a doctor. I had met a few doctors and wasn't necessarily deeply inspired or moved by the work that they were doing. And so I went off to college, and my first summer after college, I delivered pizza, and I worked in a government office. And as Minnesotans say, it was interesting, right? Didn't find it fulfilling right here. And so then I went back to college and I had a conversation just like this with a girl across the dinner table. And I said to her, you know, when I was in high school, we did some fundraising for Camp Heartland. Camp Heartland was a camp for children with HIV here in Minnesota. And I said, I want to do something like that. That seems like it's making a difference. That seems like it's moving the world forward in good ways. And she said, you should work at my camp. And I said, what do you mean? You have a camp? and it turns out, Shaletta, that she had had leukemia as a child. She had grown up, defeated leukemia, and ended up working at these camps started by Paul Newman, the film actor. So Paul Newman used all his charity money, his lemonade money.
The salad dressings.
The salad dressings,
yes.
all that stuff. And he used it to build a camp up, amongst other things, to build a camp for children who had blood diseases, HIV, leukemia, sickle cell anemia, diseases that really try to steal childhood from young people. And so in an effort to rebuild that childhood, he built this camp. And I got the privilege of working there for what ended up being 3 summers. The philosophy of this camp, Shaletta, safety, respect, and love for everyone. And I think that's something that we could all use.
Yes.
But particularly when you're combating illness and you're trying to recapture childhood. It was very, very moving. And so I ended up working there, and I saw there physicians and nurses and healthcare providers and social workers who were trying to do good by people. And that was the kind of, I think, motivation, the kind of heart movement I needed to walk down a pathway. And I said, I like science well enough.
Yeah.
Could I go be a physician? And so I ended up working for this organization for a long time and worked in Southern Africa. It was at the peak of the HIV epidemic. And how do we build resiliency? How do we build joy in the lives of young people who are struggling with disease? So all that moved me down a pathway to medicine. And had I known how long the journey is, I don't know if I would have walked down that pathway either. But boy, what a gift it has been.
And you have been a gift to this community. But today we're talking about insurance. And I need to find out from you, why is health insurance and having it so important to you personally as well as to patients?
Yeah. Shaletta, I once went to a community meeting, and an elder was there. And she said, the first prayer is always for health. And it was like, boy, that's the truth. Boy, that's the truth. It's not really about insurance. It's about making sure that we get the health care we need and want when we need it. So here's the thing. We live in an amazing country, and if you have an ear pain right now, Shaletta, you and I could go to the doctor, and they would be able to look in our ear, identify it, see if there's an infection, and give us the medicine, all in pretty quick time. But the truth is, you and I would not know what that cost us.
Yeah, no, have no idea.
No idea. And in fact, the doctor has no idea how much that costs. When I'm a provider and providing care for people, I'm doing the best by them. But the truth is, I don't really know what it costs when I prescribe that medicine. We try to think about it a little bit, but we're just trying to do the best medicine we can.
Right.
And so people don't have a sense of the cost. So I looked up some of this stuff. Okay? A clinic visit costs you on the order of, if you're paying out of pocket, $150, $200. Okay? Just a clinic visit to go get that ear checked. An urgent care visit, maybe a little bit more than that.
Right.
$200, $250. If you're going to an emergency room, you're starting to $1,500 to get through that emergency room. If you need a CT scan while you're in that emergency room, that can cost anywhere from a couple $100 to $6,000. And that depends on what they're imaging. If you end up having to get admitted from that emergency room into the hospital, $2,500 a night, more or less, and that of course depends on what they're doing. And the truth of the matter is that even if we can get the care, we may not be able to afford the care. Well, the truth is we probably can't afford the care. So when we think about insurance, it's really that ability to make sure that we can seek the care we want and need at the right time without having to worry about bills coming our way on the back end.
Okay, now what is health insurance? Because we know we need it. We talk about it. It is dominating the news cycle. And the last thing you want to do is get sick and not have that insurance card where you can go into the hospital or the doctor's office or the urgent care and get what you need. But a lot of us don't really even understand at its basic level what it is.
Yeah. So let's say we go to that clinic visit, Shaletta, and get that bill. The truth is, you know, most of us won't be able to pay for that. And so what insurance does is says, we're going to collect monies together and prepay. We're going to prepay it or partially prepay it, and we're going to make sure that you can access the health care that you need in the moment that you want it without having to pay the full expense.
Okay.
So the traditional way that this has been done in this country historically is we're going to say all the people who work here, you know, in Hennepin County or at the state of Minnesota or at the private business, we're going to collect our money together and we're going to prepay.
Okay.
And we're going to prepay into the health system so that anyone who works here at our company can go access that hospital or at that clinic. It's actually started, in the 1920s, 1930s down in Texas. Teachers pooled their money together, and they said, we're going to pay this hospital in advance so that if our teacher colleague gets sick, we're going to get them the care they need. That's how this all started.
Okay.
That definition that I just gave you is dependent on you being employed and in the same place, part of a system, right? Part of an employment system that says we're going to collect our money. But the thing about insurance is we now have options, whether through Medicare or Medicaid, things that we're going to explore in this podcast, to get insurance, even if you may not be employed in group with other people.
And that is a big deal.
It's a huge deal. It's a huge deal, and it offers opportunity to seek care. And not just the hospital care, but the preventative care, the staying healthy care. It allows our neighbors, our friends, our family, who may not be employed currently, or who may have retired, the option to get and seek health care. And Shaletta, if we don't seek that preventative care, if we don't treat the lump when it first starts, we know that it can get worse. And so we need to address these things early when they're addressable. And that's why we want people seeking out health care when they're worried about something.
Okay, but tell me, what is public health care? I need public health insurance. That's what I need to know, because, you know, a lot of people are, you know, between jobs and they think they don't have options. A lot of people are retired and they think that there's nothing available for them when they want to go to the doctor. And like you said, they put off seeking that health care. So I need to talk about what is public health insurance, because for those people who are watching or listening, I need them to know that this is an option.
Yeah. So public health insurance says that just because you may not be employed right now doesn't mean that you should avoid health care, right? It says no matter your status of employment, we're going to figure out a way to get you the health care you need. Two flavors of public health insurance that we should really address.
Okay.
One is called Medicare, and people have heard of it, but just to spell it out, what it is. Medicare is an insurance program for people who are 65 or older. This is something that many people have paid into with their paychecks, their taxes over many, many years. But at 65, many people can become eligible for Medicare and then have government-supported and sponsored health insurance. So that essentially says all of us who are 65 or over are collecting our monies together. We're prepaying for that health care.
Okay.
That's one flavor. What we're going to talk a lot about on this podcast is something called Medicaid.
Okay.
Medicaid states that if you're not employed and if you don't make a certain amount of money, if you are struggling financially right now, you may not have access to a lot of dollars, we still want you to take care of those basics of health. And not only that, if you get sick, we want to make sure that you're getting that care. And so Medicaid is for folks who make under a certain amount of money to allow you to have health insurance. And so if that applies to you, there's health insurance out there.
Okay, so who's eligible?
Yeah, so there's a couple of eligibility criteria that are that are necessary. So you have to live in Minnesota.
Okay.
You got to live in Minnesota if you're applying for the Minnesota Medicaid program. Interestingly, Medicaid is run state by state. So there's different flavors of Medicaid at every state. Minnesota has a larger Medicaid program than many states. So, you know, each state you have to check in on eligibility. But to be eligible for Minnesota Medicaid, you have to live in Minnesota, and you have to make under a certain threshold of dollars. There is also something called MinnesotaCare, just to make things a little bit more interesting. We have MinnesotaCare as well. And that means if you make a little bit more than that qualifies you for Medicaid, you have a few extra dollars, you're working and you have some few extra dollars, but not enough to get that private health insurance, or your company doesn't sponsor it. There are opportunities for you to qualify for health insurance through that program. And that's called MinnesotaCare. It's derived from Obamacare.
Okay.
Yeah.
Now, you have to tell me how and where can folks sign up for either medical assistance or MinnesotaCare. But because there's some people watching who have lost their jobs, who have gotten divorced, whose hours were downgraded on their jobs, and they do not qualify to get health insurance. And they're sitting there with the lump. They're sitting there with the earache. They're listening to you talk, and they're saying, this is me. Where can they go to take advantage of all the things you've been talking about? Yeah, and we would strongly encourage, if that's you, we want you to take action. There's a couple places you can go. There's a website called MinSure, M-N-S-U-R-E, MinSure. And that website offers eligibility calculation. For this question. Are you eligible for Medicaid, MinnesotaCare right now? And then it also offers the opportunity to work with navigators. So these navigators are specialists in health insurance. They know the system, and they will walk with you as you try to navigate how to access health insurance and then how to use it. Because that's complicated. You need somebody to hold your hand. It is hard. And so MinSure is a great place to go. And then if you find what we're talking about interesting, Hennepin Health /podcasts. We will have information out there to help you navigate and find health insurance. Exactly. Now, each fall is the annual health plan selection time, and this is a time where folks can go and switch. So this time is crucial. There's a time limit on this thing, so you can't get this information and put it on your to-do list and wait. Talk to me about that time sensitivity. Yeah. So every year, the state of Minnesota opens up a window of time in the fall, and that's why we're talking right now. We want everyone to be cued into this. In the fall, there's a window of time that you can go sign up for new plans. If you miss that, you may have to wait a long time. So you have 4 podcasts total. That's right. This is the first one. That's right. 3 more are coming, where you'll be talking about a bunch of different topics with some community members and some stakeholders to demystify Medicaid. And I'm so grateful to you for sharing this information with our podcast family here in the state of Minnesota. Now, we spent this entire podcast trying to demystify Medicaid, but there's more you may want to learn. So go, like Dr. Krish said, to MinSure.org, MNSURE.org. Now listen, if this show has been helpful to you, there are more episodes. Make sure you check them out at hennepinhealth.org/podcast. Make sure you like them and share them with everybody that you know and love who can benefit, because, you know, everybody has a choice, right? Everybody has a choice. Everybody has a choice. And we are so grateful that you and your guests are spending time with us. Now, Dr. Krish, you have something that you tell people when you are out in community every time you meet them. Go ahead and give them your tagline. Yeah, we know you have a choice on how to spend your time. Thank you for spending it with us. Stay well and be well.